So in this presentation, I'm going to briefly touch upon the methodology that I use to write the report and the methods that they use to collect the data for the report. For those of you who have skimmed the final report, you may notice that it's 99 pages long. So I will go over some of the key findings given the about 1 hour time slot that we have, and then also some of the recommendations that I see. But most importantly, I really want to devote this time to not just a Q&A session, but more of an open-ended discussion. I don't know how often you guys all are in the same room together, so I want you guys to look at some of these figures I present and brainstorm ideas collaboratively. I think that would be a good use of time. So saying that, I may speed through some of the slides so we can get to that part of the conversation. Next slide. So the point in time count, the report includes 4 different data sources. The unsheltered data, which is the survey that we were discussing earlier, where people go out and actually count and survey individuals who are unsheltered. The shelter data comes from the housing inventory count, which is an inventory of the providers in the community. Those two are required by HUD. However, the jail data and school data are not. The jail data was obtained from the Pinellas County Sheriff's Office, and the school data was obtained from the Pinellas County School Board. So although they're not required by HUD, nonetheless, they still provide paint a better picture of homelessness in the community. And so to put all of this data together, I did some descriptive statistics to provide a visualization. But what I'm most excited about is the geospatial analysis. So the unsheltered data was collected mostly on tablets. So we were actually able to get the exact latitude, longitude coordinates of where the surveys took place. So as I'll show you later on in the presentations, we can actually see hotspots and where more and less densely populated areas are. And we can do the next slide. The overall results, so between the sheltered and unsheltered data, there were 2,144 people identified as homeless. In the jail, 675 people were identified, and in the school, 3,768. One caveat I do want to say is that the sheltered, unsheltered, and jail data were obtained from one single point in time. The school data is obtained throughout the school year. So when students enroll, they complete a questionnaire, and this will ask about homeless status. And then throughout the year, students may alert their teachers, social worker at the school, and then they will then enter them into a management system. So this school data was not from one single point in time and may overlap with jail or sheltered or unsheltered data. Same with the jail, that data could potentially overlap with the sheltered and unsheltered, but what I can say for certain is that of the 2,144, all of those are deduplicated and represent individual people. So there's no overlap between the unsheltered and unsheltered counts. And then next slide, please. Here is a breakdown of the gender, racial, and age characteristics for all of the household types. Within the shelter data, there is emergency, transitional, safe haven, and domestic violence. And the domestic violence can be broken down further. So these represent all of the household types. As you can see, the majority of people identified in the shelter count were male, and a relatively even breakdown between those who identify as white and African American were found. The other category represents Asian, mixed race, and a few other racial categories specified by HUD, but very few people were involved in that. So I grouped all of those together as one other, so you can get a better visualization of what it looks like. The age characteristics was relatively even, which I found interesting, with the notable exception of people who are 18 to 24, which is this little yellow sliver right there. And next slide, please. To break it down further by the household type, we can see that When there are households that do not include children, they are more heavily populated by people who identify as male. The male is the blue column, so as you can see with no children, approximately 70% were male. However, when you look at the yellow columns, in the at least one child and one adult, or only children, unaccompanied youth and parenting youth, they were mostly female. Next slide, please. When you look at the shelter types, so emergency shelter, transitional housing, and safe haven, those are all mostly populated by people who identify as male. Next slide. This one is the racial characteristics by the household type. We can see kind of a similar trend with the gender. When we look at households that do not include children, they're typically consisting of people who identify as white. But when we look at households that include children, there's a higher proportion of people who identify as African American. Next slide. And once again, at the end of this, I know I'm going quickly, we can always go back to look at some of these pictures, and they are in the final report if you guys, do they have a copy of them?
Everybody should have it in their email. This is in the meeting. And it will be available on our website by at least 5 o'clock, if not sooner today.
And here is the racial breakdown by shelter type. There's relatively even between people identified as white or an African American distribution in the emergency shelters. But when we look at transitional housing, approximately 70% are identified as white, and we start to see this even dispersion kind of dissipate in the transitional housing arena. Okay, next slide.
You're taking questions afterwards. Yes.
Yeah, I mean, I want to take questions as we go, but time's sake.
Okay.
If you could just write them down or something.
I am.
And y'all, I apologize. I can't actually move that screen that's in the top right-hand side. It's not on my computer, so I apologize that it's blocking the view a little.
Here is what I find very interesting. Some hard truths, I think, was a phrase mentioned earlier today. And in this trend data, we can start to see that there are some hard truths we need to face. When we look at the gender trends, there's been a relatively steady downward trend in male. That's on the left side, that's the blue line. And then in 2022 to 2023, a sharp increase. Females have remained steady. But when we move over to the right side, which is the racial characteristics, the green represents people who identify as white. That has been trending downward. However, we see on the blue line is people who identify as African American. That is steady, remains steady, but has then started to trend upward and kind of match where it is. So we see a downward trend essentially in people who identify as white, and we're starting to see this upward trend now in people who identify as African American. Next slide. Here is the trends over the total counts by the shelter type. Light blue is the emergency shelters, green is transitional, and the gray is safe havens. The total count is in yellow, and that typically follows the pattern. The blue and the yellow kind of follow the same pattern. And we see that because most of the people who are sheltered are going to be in these emergency shelters. Next slide. Now we get into some of the very exciting stuff. The unsheltered data that allows me to use some geolocation and hotspot analysis. Do you mind actually going back to this is a hotspot analysis. So the darker shades represent higher concentrations of where unsheltered individuals were surveyed. This may not mean where they spend most of their time, but research and conversations with people mean that they're going to stay relatively in the same location. So this indicates areas that I'll talk about later that deserve some targeted approaches where we can see and introduces some questions of, we see the hot spots. Does that mean that there are no people who are unsheltered in the cold spots. The areas that don't have any coloring in them. The next slide, please. Here's the gender, race, and age breakdown of the unsheltered individuals. Most people were male and identified as white. And once again, there was a relatively even distribution of age. However, we can see in the green and then the dark gray and the light gray, these are people who are 45 and up. So 45 to 54, 55 to 64 is green, and 65 plus is gray. So over half of the people are who are unsheltered are over 45 years old. Next slide. I know this is a very busy slide, but I want the opportunity for you guys to actually play with the data yourself. So do you see these QR codes? This is the one time the professor is allowing you to have your phone out. If you take a picture or just pull up your camera on your phone, it will take you to an application on your phone and you can actually zoom in on these dots. And I want to see, save that for, our conversation at the end, but I do want you guys to explore it for yourself and actually look at the data. But just in case you don't want to, I provided pictures. The first on the far left is the race by location. The dots in red are those who identify as African American, or white, identify as white, excuse me, and the blue are the ones who identify as African American. And we can see there's a higher concentration in the southeast region of the county, right around the St. Petersburg area. If we have time, we could probably pull up the link on the PowerPoint maybe. It's gonna be the title, race by location. If you just click that. If you click the title.
I did, it's,
See if it works.
give me a second, I'll have to share a different screen real quick.
I have just a quick question for the dots. Is the dot one person?
One person.
One person.
Well, so it's one person, but some of the surveys were conducted in the exact same location.
Okay.
So there is a possibility that there is some overlap because, if there's two people there, you may have.
Phosphation, something like that.
Mhm. Right. So here's kind of what it looks like, and you can actually, I made these in the report itself, there are links to it, and I think they're gonna go up on the website. You can select which demographic characteristic you wanna look at, and you can actually zoom in, so maybe you can zoom in on some of these areas. And we won't go through every chart for the sake of time, but when you look at the aggregate, you can see that a lot of people tend to be located in parks, around bus stops and transit centers. There's higher clusters. And I live in Hillsborough County, so I don't know the exact areas, but there are areas that HLA identified as, shelter areas. And I said, because I kept saying, why are there so many people here? And it's because that is where some of the services are provided. But you can get down to the street level in this and actually use this to target outreach efforts.
Can I go back to slide two?
Yeah. So these charts, we won't go through all of that, but you do have the QR codes and it's in the final report where you can get a link to these maps. Part of the point in time count survey is questions I find fascinating that look at substance use, mental health, disability characteristics. So I will talk about some of those now. Of the respondents in the point in time count survey, the majority, 60%, denied alcohol use. and 74% denied drug use. The dark blue are people who denied alcohol and drug use. So it's an interesting thing in terms of stigma, because many of us see somebody on the corner who maybe is disheveled, and sometimes people assume, oh, that person's high, that person's drunk, they're clearly homeless, they're a drug addict. You know, you see these words all the time. But what this data shows is that it's not really the case. The vast majority of people who are unsheltered are not reporting drug or alcohol use. And then next slide. The mental health characteristics, so 51% denied a mental health diagnosis, and the column to the right is looks at the mental health characteristics by race. So the highest proportion, so over 50% of people who reported a mental health diagnosis identified as a race other than white or African Americans. This is including the mixed race, Pacific Islander, Asian American. So although they only had 20 people who responded yes, that represented over 50% of that unsheltered population. When you start to proportionalize these things, I think to your point earlier, you can actually make a more accurate comparison between races as opposed to the raw count. In the final report, I don't always make these proportional comparisons, which is why at the bottom of it, I include the raw data so that can still be done. And next slide. Here is a map of the latitude, longitude coordinates of where people who identified having a mental illness were located. One thing I wanted to mention, but I can still mention it here, is when you look at all of the dots, this is slightly an aside, but still a point to it, is you can start to notice a upward diagonal trend of where those dots are. And that actually, when you impose it on a more specific map, follows train tracks throughout the county. So it kind of follows through when you go up there. Next slide. The physical disabilities, so 56% of people denied having a physical disability, but in the light blue, 35% of people reported having a physical disability. And once again, this bar chart to the right demonstrates that people who identify as a race other than white or African American proportionally reported higher rates of physical disability. Next slide. And wherever you see the QR code, that indicates that there is a map available, so you can actually pinpoint where they are. The access to health services, 70% of PIT respondents, so unsheltered, reported that they had access to healthcare, which can be taken as good or bad. However, 19%, which is in the dark blue, denied having access to health services. When you look at the racial breakdown, the people who identify as white, about 75% reported access to healthcare. But when you look at people who identify as African American, 60% reported access to healthcare in the unsheltered population. Next slide. Here provides the primary reasons that housing was lost. This is a question included in the point in time count survey. And this survey, I keep referring to it, is in the appendix of the final report that you guys have. So you can actually look at these survey questions. The most frequent reason that housing was lost was financial problems or lost job, and then followed by family issues, medical conditions, alcohol, drug use, and then eviction. Next slide. This provides a map of where the people who reported eviction are located in the county. So although eviction was the fifth most reported reason that housing was lost, I wanted to highlight this because eviction is highly problematic, most importantly because it tends to stay on your record and makes it difficult to find housing in the future. So if we can start to target areas where people are getting evicted, we can prevent that cyclic nature of homelessness, especially amongst people who have an eviction on their record. So I think that is a very important thing to keep in mind to prevent these evictions. Next slide. Chronicity. So this is a map of the chronic people who were identified as chronically homeless. The definition is somewhat complex, but essentially it means that if you have a disability and have been homeless for 4 times in the past 3 years, 4 episodes of homelessness in the past 3 years, or a total of 12 months, then you are chronically homeless, identified as chronically homeless. The blue represents those who were chronically homeless. So in the unsheltered count, over half met the criteria for chronic homelessness. The dark blue represents where those people were surveyed, while the green represents the people who were identified as not chronic. And once again, that's an interactive map, so you can zoom in and get as specific as you want. Next slide. The total number of persons, unsheltered persons, has trended downwards, which is, great, actually. In 2016, it was nearly 1,200 people, but in this count, it was 646 people. And that's great news, but there's always the but. There's always the but. Is that because Pinellas County has just done a fantastic job? And just listening to your guys' conversations, no, I think you have. I think you definitely have. There's also the concern that how many people are we not counting in these cold spots? Does the data truly reflect the actual count of unsheltered? And Victoria brought this up in terms of this is why there is a very high importance for that volunteer work to go out and count, to truly get an accurate reflection of homelessness in the county. Next slide. Here are the trends broken down by gender and race. There has been the most steady downward trend in the dark blue, which is male. But interesting enough, the light blue started to trend upward in 2023. We can speculate reasons possibly in the Q&A, but that is something of note. On the right, we see a steady downward trend for all of the races. Next slide. Here is the jail data. So on the night of this count, 2,840 people were in the Pinellas County Jail. Of those people in the jail, 675 were identified as homeless, which is about 24% of the jail population on that day. Next slide. When we break it down between race and gender, the majority of people identified as white and male. Next slide. Here is some geolocation data for the zip code hotspots. So when people were booked into jail, part of that booking process was where did you spend most of the time before your arrest when you were homeless? And not all of the data, so as you can see, there's of the 675, not everybody is represented. Many people didn't know the zip code where they spent most of their time or the city of where it is. But of the people who did report zip code data, these are the hotspots of where they are. So this follows kind of that unsheltered trend. So remember, these are different data sources. This is not HUD data. This is the Pinellas County Jail data. But we see that people are spending most of their time in the St. Pete, Pinellas Park, Largo, and then Clearwater area. And I wanted to highlight, this is the most densely populated zip code, which had 78 people at the time, was the 33762 zip code, which is where the jail and safe harbor are located. Next slide. The slide on the figure on the left represents the jail trends. There's been a steady upward trend with a slight divot right around the COVID years, and that's more likely than not due to the arrest policies, and maybe law enforcement can speak on this more heavily, but throughout the nation, there's been kind of a impetus during COVID-19 to minimize the amount of people in jail to prevent the spread of disease, et cetera. And we see that there has been a decrease in that. And that is worth conversation during the Q&A, because if they could decrease the amount of people in jail at that time, perhaps we can do it during this time. The figure on the right is broken down by jail and unsheltered, and for the first time in 2023, we see that unsheltered is going down, jail is going up, and jail for the first time is higher than the unsheltered count this year. Next slide. The school data is I think you mentioned it's interesting, and a hard truth, I think, that we need to discuss. So approximately 4% of the student body were identified as homeless. And the type of homelessness is slightly different than the HUD definition, but nonetheless similar. Most students were identified as homeless with the shared housing status. Next slide. The racial breakdown is as follows. Although approximately 4% of the students were identified as homeless, 9%, about 9%, 8.5% of the homeless population identified as African American. That was nearly double all of the other racial categories. Next. And we could see the trends have remained relatively stable across time, slightly upward with the shared housing, and then a decrease in 2023. So we see that it looks that at the peak, 2022 was around the highest count, but it has started to trend downward. Next slide. So the recommendations. There's quite a few. There's to preface this, there is a more detailed discussion in the final report, which I encourage you guys all to look at. I'm just going to read through these and save a more detailed discussion of the recommendations for our Q&A session. I think that's probably the most appropriate thing to do while we have everybody in the room. So start with enhance the work being done with Built for Zero to detect incidents of homelessness and promptly connect individuals with housing. The goal is to reach a functional zero status, and you can discuss maybe some of that in the discussion. And during the point in time count survey, utilize a plainclothes approach by law enforcement when conducting the unsheltered count. Law enforcement are key in this count for a variety of reasons, safety, as well as their in-depth knowledge of where people are and their knowledge of the community. So we need law enforcement in this. And I think to enhance the ability to connect with people, maybe use a plainclothes approach the best you can. Because people may not be as you saw, we had questions about substance use. I don't think I'd tell a cop that I'm shooting up heroin, but I might. It depends. Maybe if you're have a good smile, I might tell you.
Not a cop.
Oh, yeah.
People tell me that all the time.
Here, it's not good when you wake up. So the next one would be design and advocacy, community outreach and communication strategic plan with measurable outcomes to address the stigma towards stable housing initiatives and people experiencing homelessness. This is twofold, so I'll briefly discuss it. Not only is there a stigma against people who have who experience homelessness, but there's also a stigma against solutions to fix it. There's a thing called the not in my backyard phenomenon. So we have strategy. We know permanent supportive housing works, but many people don't want what they perceive as a homeless camp in their backyard. But I think was mentioned earlier, they're nicer than my apartment. some of these housing opportunities. So to address this stigma towards the solution, we need to have more people with lived experience. One of the best predictors of reduced stigma, the biggest factor associated with that is positive exposure. The more positive experiences that I have with somebody who I previously had a stigma against, I can reduce that. So how do you do that? You increase exposure to people by including them in committees and all types of advocacy outreach. Also, be proactive, creative, and collaborative when identifying and applying for funding to address homeless and related issues. We see that there is still substance use problems, so maybe you can be more creative in funding solutions where you can collaborate together on things like clean needle exchange programs, or other interesting phenomenon, or programs for interesting phenomenon that the data show. Importantly, we need to solicit the needs from those who have lived experience and non-clinical community stakeholders who frequently encounter individuals who experience homelessness. I wouldn't limit ourselves to, people in this room, but who interacts with people who are homeless, experience homeless the most? Bus drivers, librarians, people at the gas station. So use some qualitative data to actually, and focus groups, and get their opinions as well. Importantly, adapt the point in time count survey methodology to match the community needs. So discovering ways to get those cold spots, as well as to include questions to ask things like, what's preventing you from accessing care? We know that there are barriers, or we know that you perceive that there's not access. Why? So including questions in the next point in time count survey to clarify some of these data needs. And then establish a user-friendly interface to publicize the identified data so individuals can access and expand upon the findings as they emerge. Next slide. Convene regular and sustained planning meetings with criminal justice system personnel to review policies and procedures and strategies to address homelessness, as we see that this does affect the criminal justice system. And for the first time, it was higher, the jail count was higher than the unsheltered count. So including criminal justice system representatives in planning meetings is of utmost importance. Also, we need to increase family outreach services and shelters to address non-homeless related parenting issues. As you saw in some of these figures, that there are quite a few children. And there is a direct correlation between things such as an inability to read and criminal justice system involvement and homeless system involvement and welfare involvement. So actually having opportunities to increase parenting related classes and classes for children to prevent them from being another statistic as such. Also develop and expand formal partnerships with colleges and universities to conduct health outreach services. So some of these partnerships are already in the works, but looking at creative and collaborative ways to perhaps work with nursing schools to go out and provide street outreach. Many of them need hours to graduate or they need clinical experience. So use that, develop these relationships with colleges and universities to get this labor pool and help address stigma through the positive exposure. Very important to me as well, I work in this field, implement and strengthen self-care initiatives for the providers. The providers are the backbone to everything. I get the luxury of standing up here and making recommendations. You guys are the ones who have to do the work. And to do the work to the best of your ability means you need to have the workforce who's motivated to do so. So take care of the people who work underneath you guys. Map the gaps in resources along the homeless system of care to improve targeted outreach for minority populations. And foster partnerships across municipal boundaries within Pinellas County to improve buy-in from cross-jurisdictional leadership. So we can see, for example, in the jail data that there is hotspots in these zip code areas. So we need to have people who represent these different jurisdictions in the room together and say, hey, maybe we do have a problem. Let's work together to fix it. It's the next slide. I always like talking about this elephant. It's not the elephant in the room, but this is a good representation of the importance of strategic planning. Every single person here thinks it's something different. So when you're siloed, I may think that the tusks are a spear, or the trunk is a snake, or the tail is a rope. But not until I take a step back and reduce the fragmentation between the siloed systems of care. I won't know that it's actually an elephant, and he looks kind of perturbed about this feedback. So work together and include collaboration and coordination so you can see the full picture. Next slide. That is it.
Raymond, I just want to say this was a beautiful report, and I'm sure you're going to do absolutely beautiful on your defense. And I think that this is really showing the importance of high quality research, and not only partnering with our university partners, but encouraging us all working with the university staff and students in different colleges. So beautiful job, beautiful report. Thank you.
All right, questions, Trinia?
Yeah, I have one question. I'm looking at, utilization of, services by African Americans. It tends to be heavy with emergency support services. And I'm trying to understand why aren't they accessing other services? What's the barrier? What's the reason for that? I don't know, you have the answer.
Well,
But you might, but I'm just,
Sure.
I'm looking at some, a little discussion about that. Why are African Americans not accessing transitional housing? What's the barriers? What's at work there?
I think that I definitely want to open that up to discussion because I don't want to spend the time speculating, but I want to point that very question to the importance of, to answer it, we could include something like that on the next point in time count survey.
Yes, with that. Right.
But that warrants discussion, if you guys have ideas.
I mean, the thing here is what we're looking, the data we're looking at is just where people are counted. So if they're counted in shelter, most of the shelter that we have is emergency shelter. So that's where most of all of the people are counted. And then if you look at the transitional housing, HUD doesn't fund very much transitional housing. So we have 200 and some beds of transitional housing. Most of that housing is veterans, right? And the veteran population is mostly white. So it's more program related than it is.
So it's funding driven.
It's funding driven, exactly. But also I think the thing that the point in time data doesn't get at all is looking at the housing first approach to housing. Where we want most people to be served is prevention, diversion, and then rapid rehousing in terms of serving raw numbers of people. I think you could fairly say that we're underpowered for rapid rehousing in terms of how many people get served through that. And that's where most of our African-American population who become homeless should be served in an ideal homeless system of care. And those aren't reflected in the point in time count because once they're housed, then they're housed, so they aren't in PID. And before they're housed, they're either unsheltered or in emergency shelter, so that intervention isn't captured in point in time data in the same way.
And that's not the experience for white populations of homelessness.
Well, no, it is, it would be too, but I think the reason the disparity really shows up here, like it is partly age. Like if you look at our homeless populations, you have sort of three very different populations. There's families with homeless families, and that has the most disparity in race because it's 2/3 of the homeless families are Black or African American, and then again overrepresented with Latino and Latina families, whereas singles are mostly white or 2/3 white. So still Black people are overrepresented in single homelessness versus the population, which is a problem, but not a problem that's in the system of care necessarily. And then vets are a totally different population because they have access to a range of services that other pieces of the population don't have, and they're disproportionately white. So it's an overlapping factor.
It's a smaller number, but the only thing really in the report is the safe haven, which is a small number set intervention, but I don't know if that slide's still,
Yeah,
can go back, but I think it was around 45% that is black. But then what's not represented here is permanent supportive housing, because they're not
They're
considered
housing,
homeless.
right.
However, they were the previously homeless, and safe havens feed permanent supportive housing.
Yeah.
So when you look at PSH, I think that's because that's a big intervention. You're talking about getting into services, so we might want to look at that as part of the story, even though I know they're not certainly homeless for the point of this account. It does answer some of that questions, and also maybe the rapid housing data or something to show our interventions, because I don't know that this is the whole story of all of our housing.
Yeah, because I actually, if you go to the unsheltered trends from 2016 and 2023, we're sort of basically arguing that the unsheltered population based on the PIT has decreased by 43% in that time period. So if that's the case, then logically we're housing more people, and I don't think that that's necessarily the case, but it jumps out that way.
I don't know, but that is one of my notes, that I think what we need to, when we make that statement, we have to compare it to our volunteers, just as a footnote, because how do we know that in 2016, we didn't have 100 more volunteers
Right.
than we did? And because your volunteers are a direct correlation between your number of surveys, and if you survey more, we all know we can't get to every cold spot and every spot in the county in one day. So we utilize our resources as best as we can, and so we should be comparing our unsheltered numbers with our number of volunteers. You're not necessarily comparing. apples to apples.
That is a good point. I'm not sure off the top of my head, all the way back to like 2015 or 2016, how many volunteers they have. I do know that this year we had the highest engagement that we have had, in part thanks to law enforcement. Corporal Reeves really rallied law enforcement, and fire departments were more involved this year than they had been previously, which allowed more of the encampments and railways and whatnot to be surveyed. But again, that also goes into then there are uniformed officers out there conducting surveys and whatnot, and there's a whole, thing there. So
But
this year was the
go to
highest
that-
number of
go to that for a
volunteers.
Because when he said that, I wrote myself a little note that, this recommendation that to utilize a clothed approach by law enforcement. I think one thing that I think, and maybe I'm wrong, but I think that all our law enforcement agencies or our agencies countywide have done a better job over the last several years. And I'm not trying to give Holloway all the credit, but the sort of stop, walk and talk, like that there's better, more pro-social positive interaction between law enforcement and the homeless populations. So I'm not sure if that's a recommendation that would somehow change the numbers, because you're in law enforcement, so I'm just looking at you and you're.
Firefighter.
I can't see,
Different job.
but. So I can sit over there, so it's really thrown up there. But the point actually being that, is that a recommendation that's as necessary? Is that gonna somehow really change the interaction? Because even, looking at what we do in all our different offices, the more engagement we have with law enforcement, we open the harm reduction program. The more often law enforcement's been around, we're seeing more people coming because they feel safer to come. And these are people who typically would run the other way. So I'm just wondering, like, if we're being counterintuitive that way. Does that make sense?
Yeah, and the law enforcement officers that did participate, and I can speak for St. Pete and Sheriff's Office, I'm not sure about the other, that's how, no, part of it. I know it's all community policing officers.
Right.
Community policing deputies, these are people that are looking at creative solutions, not black and white cops, these are people that are looking at. As far as the plainclothes approach, whatever, I don't know if we got enough plainclothes cars to put out, because they're still gonna roll up in a market.
Right.
You're still gonna know who's getting out of the car.
But you would look at the approach overall, and I've
We've got a
said this.
sheriff's office that runs, the sheriff's office runs the largest single adult facility in the community.
And after as many years as the sheriff's office has been doing that, it's not seen as this, because I remember when, before we opened Safe Harbor, I remember when Bruce Wright came in with his guitar and was singing songs about how we're trying to criminalize all. Well, it's not the same perspective anymore.
No.
And you guys remember that? I don't know why that popped into my head, but I think that, and to Sheriff Walteri's credit, to Holloway, Chief Holloway's credit, programs like Call and like the arrest pre-diversion, or having mental health counselors dealing with officers versus having the officers who don't have that mental health training. All of these things are been positive things in our community that the people we serve, hard to serve populations, don't have the same negative reaction as seeing someone who's dressed in their uniform. And I don't know.
Wearing a uniform, I can speak to that. I mean, I made him as a cop when I walked in the room anyway, so
Well, he-
plain clothes don't matter. Because to your point, Michael, things have changed, and we go out with the fire department and our police department in Treasure Island, and we know all of our residents without addresses or unsheltered. They're willing to come up to us and we're identifiable because we're in uniform.
Right.
They know we're a friend, not a foe. Because of the attitudes that have changed, honestly, we have the trace tablets, the diversion training. Treasure Island and Gulfport have partnered to hire a caseworker, a social caseworker that starts the 15th of this month. It's a 4-year initiative finally bearing fruit. We're very excited to go out. Tethered, untethered, doesn't matter. I think in the past, the tethering was a big deal for security, not really necessary, I don't think. Is in my opinion anyway. But the uniform does get that little measure of, I don't want to say respect, but acknowledgement from the folks that are willing to talk to you a little more because you're seen as a community helper.
And I think that attitude shift is really dramatic, and you got to give people credit for making those moves. Because I think you said on number 8 or something, the regular planning with criminal justice personnel, criminal legal personnel, or systems that we are approaching it differently.
I mean, I don't really think that, for me and how I've had interactions with, like Clearwater Police, the uniform really doesn't have anything to do with it. Their energy is gonna introduce them for their, and, the energy, some of them are genuine and they do want to help, and that's why they took the job. But then there's the other ones that, like to be a little patronizing, just because they can have had interactions with it. So it's the golden rule. The officer. Yeah, and it's the golden rule. I mean, it's simple. It is so simple, like.
I made a note early in the presentation before the plainclothes recommendation came up, when I think when you were talking about like the mental health and substance use and how there's this stigma of homeless people, or drunks and all this kind of stuff, and how the data shows that there's, that's really not the case. And my argument isn't on that, but it's more on the footnote of this conversation. And I do think it is less about the uniform as it is the style, but you said the approach, and you take volunteers, you're getting volunteers of all sorts, and you're not doing any sort of personality inventory, for your volunteers. You're just happy to have a volunteer, and you hope that they listen to the training and do a good job. But I'm in the mental health field, and I can tell you I have plenty of trained mental health people that, I'm like, oh, is it really set up that way? So there is a certain reality and a certain skill set to engaging people, and, outwardly talking to a total stranger about my mental health and substance use issues is not easy for a lot of people. And I think there's probably even, you could look into that even from a cultural perspective and find even more trends there. So I think you have to be careful with that data point, but there's a footnote that this is a self-reported instrument, and that I often think that the mental health and substance use piece is very well understated in the point in time. I feel like it always has been, because of that nature.
I mean, when the appointed time does go out, like, do y'all explain what it's for? You know, it's to get more funding to help get the services.
It is, and sometimes I think that helps, you know, I mean, and the right style of interviewer person can get that out if they feel this is non-threatening, but then there'll be some that even if you're a good interviewer, they're just not ready to, you know, give up that kind of information. Or they may not even have insight.
You know, you have a community
Self-report,
policing-
I'm a paranoid schizophrenic, I'm not gonna tell you, I don't even recognize that I have that. You're the crazy one, you know, so there's just these elements that I think we have to be.
And the community policing officer might know that person, might be able to nudge the volunteer and say, that's not a correct answer.
This is the first year that I volunteered that I didn't speak to anybody on my entire shift.
Wow.
Where did you go? Downtown Clearwater,
Really? What time of day?
first thing in the morning.
Really?
It was as if they all ran away. Because on any given day, driving down Myrtle, you know, it's.
Well, they're there on
not
benches,
hard.
they're at the bus station.
There were no, there were no people.
8:30 to 10,
Yeah, I think so.
they're at the same
Stay
thing.
with the phone.
Not on the nine AM. I'm telling you, I don't know what, I have never seen anything like that.
And then the refuge is open.
So-
Few places they go for food.
So we definitely need to look at how we are deploying volunteers for next year. That is one of the things that I really want, Providers Council and then street outreach teams to take back and work on as recommendations for where volunteers should be deployed next year, where law enforcement specifically should be deployed next year, because they aren't the same place. Law enforcement should do encampments along the rail line. Where else should we be sending volunteers? And then where else should we be sending, you know, Joe Smith, who just volunteers? Also, I would really like DSP, Diversity, Equity, and Inclusion, to review the survey questions. What questions are we asking and how are we utilizing the data? And then go through this information. Providers Council, Funders Council, is this data being utilized by you in any way? Is this data being utilized by your organization or your municipality in any way? Elected officials, are you sharing this information with your other elected officials? Because it's really important that that information not only be shared, but then be utilized. So, you know, do we need to schedule meetings where somebody from the HLA or the COC comes and does a presentation on this at some point for you or your organization or your municipality? I would really like this conversation to continue well beyond today, 11:56 today. So I would like this conversation to continue beyond this. Because there's a lot of work to be done and there's a lot to dig into with this data.
I also just want to add this, I know time is short, data utilization, because we're talking about data quality, you know, the approaches, plain clothes, non-plain clothes, and you know, who can approach what group and all of that, and that certainly needs attention. But also how we utilize this data has to deal with governance. When I tell you, when homeless people are telling you it's financial, they're saying that I cannot afford to live in St. Petersburg, I can't afford to live in Pinellas County. We can't be silent to that message. So how do we use that in terms of advocacy? How do we use that in terms of governance? Do we invite members of the business community to come and hear this story? You know, because maybe you're having problems with your workforce, you know, maybe because you're not paying them enough money. Or do we use this information to talk about, you know, talking to our landlords and our elected officials? Okay, now you got to give a 60-day notice before you can increase my rent. But guess what? You increase it from $850 to now $1,650, and I only get I only make $1,700 a month, if that, because the salaries haven't gone up, but the rents have. We have to take this information. We put all this time into creating this study, and it's requirement by HUD, so I know we're going to do it, and we want it to be as accurate and as much as possible. We've got to use it in terms of advocating. How do we deal with the issues? Everybody's out there's not open no. There's not doing quack. I don't have the money. And HUD doesn't deal with shared housing. but we do as a community, because children are living in those kinds of environments. And what does that lead to? Many times it creates your higher risk for sexual molestation, having done protective services management and provider services. So we have to look at this in its entirety. And I want to thank you for delivering it as well as you did, but I think it requires us to be very, very intentional about our time, figure out how we can best utilize this data and do a better job at sharing what the results are, even with the caveats that we have. We have a lot of unfinished work to do here for all populations,
Lieutenant Hayes.
And they need to be at the table in terms of governance as well as service delivery.
We do have a, vote, by the way, just so everybody knows.
So, yeah, and that's where I was going with this. If we do have to vote on this today, there are serious inaccuracies. Reference the verbiage in the jail count.
Okay.
I'm happy, if we want to adopt it, vote on it, I'm happy to sit with whoever and go through it. I don't have to be anywhere. But
Can I ask what those inaccuracies are?
yeah, there's no homeless, so on page 6 and throughout, it's referenced that they were 675 people affirmed that they were experiencing homeless when they were booked into the county jail. The report that gets sent over is only the people that were booked into the county jail that did not have an address. There's hundreds of people that are booked into the county jail that come from the Department of Corrections and come from other places that just simply indicate, I don't have an address. They're not homeless. They've been in prison for 7 years and they're going back for 10 years after they complete their, so those aren't.
It's a transfer? It's a transfer of.
It's a transfer, or they're intoxicated during booking, and when the staff is asking them, oh, where'd you live? It's, you know.
So who gave us because I was provided that definition from the administrator.
Yeah,
Of-
somebody.
of the
somebody sent
jail.
the pieces.
Yeah.
So that is,
I got forwarded the report and I don't. It didn't come through me.
It came from PCS, I'll have to
yeah,
see.
I got it yesterday and went through, that number of actual homeless. I'm just looking at it as probably far less. There needs to be a different data collection mechanism that we do for that. Because it is not,
So, but
not reflective.
these,
The verbiage is.
It's funny you bring that up, because one of the notes I wrote is, it's not possible for the jail count to be higher than the shelter count.
It's.
yeah, this is what PCS, so.
You know, I think it's to Zach's point.
I think it's in the verbiage. I think
If we just edit that
I think
to,
if we can change the verbiage in it.
that makes sense.
But I'd also consider someone that comes into jail that is literally homeless
Still.
and has been there less than 90 days as literally homeless. And
Yes.
And this report says that they're not considered.
Yeah, when you are,
So, subset of them are by HUD's definition.
They don't have a home to go to.
Only if they enter from homeless
another
status
institution, yeah.
and have been there less than 90 days. Once they've been there 91 days, they're not considered by HUD as homeless.
Yeah, so there was some inconsistencies with that, but I went off of that was the definition provided to me by the jail, so we have to go, and there are points to be made where that was the same definition used across from 2016. So despite the inaccurate version of that definition.
So I pointed this out in 2020 and I worked in CMFD to get this changed after the 2016 through 2020 5-year analysis. And it was supposed to be clarified in the verbiage after that. I found my notes from that.
okay, yeah, I can't speak to 2020, but I
No,
can definitely speak to 2023 and 2024, and let's fix that moving forward.
But to Zach's point, if we're gonna take an action, we take action.
And that's what I'm putting out there. If you guys let us change the
As
verbiage.
they're leaving there and they don't have an address to go to, I mean, to me, that's when you would actually. Right, as you're.
We can take action with the approval.
It's smart, rather than
Knowing that we're
entering.
that would be good.
You would have to go in there and say anyway to see if anything.
And so usually they send them for the same purpose.
So are you saying, I mean, just so I understand, so they have to be in the jail less than 90 days to be interviewed? No,
To be considered, well, by HUD's definition, they have to be incarcerated, came from literal homelessness to jail less than 90. Or 90
and
90
now
days.
is and in safe harbor or whatever, less than 90 days, or jail, less than 90 days. Okay, so you're only giving the interviewers, people that have been there 90 days or less.
We're literally asking them where did, it gets collected upon.
Well, I think we need to actually clarify. So the 90-day thing is correct, but it doesn't include the fact that they had to have been homeless prior to that jail stay.
Right.
So for all intents and purposes, they were identified as homeless prior to incarceration, spent 90 days in jail, and then were discharged.
Yeah.
Yeah, no, it's.
I'm saying at the day of the point in time, that data is being provided at that time, it should be only that subset of people that entered jail homeless and have been there less than 90 days.
Yeah,
That's the subset
Yeah.
you're looking for, to be categorized
Right.
as literally that's.
So moving forward for 2024's data, Lieutenant Page, can you commit to PCSO taking the time to run that really, really in-depth report to send us that, very specific data that we're talking about?
Yes.
Okay.
How long would, how long we got it?
I mean, it'll be, okay, so the report was ran for the night of January 25th. So, and then, I would like the data in February. So the night of the pit count, and then I'd like it in February. Thank you. Thank you, that's awesome.
Thank you again.
Sorry, I just have a quick question. On page 53, figure 115, says the primary reasons that respondents indicated they lost housing. Does that include families and children, or is it just a respondent?
I think I should direct that to HLA.
So that'll be, that is, when they are completing the survey, one of the survey questions is primary reason you lost housing. So that would be for them and their entire household. So if they indicated eviction, it would be for them. And if they had sub-surveys, which would be their children, or, if my husband weren't around, he'd be a sub-survey. I would be answering for everybody that we were evicted.
Okay, and then those numbers would be included in percentages. Every person in the household.
No, that is not included in the sub-surveys. That is just included in the individual.
I've been involved in PIP for over 15 years. I'd say that question is probably one of the hardest questions. We haven't really come up with a good alternative, to be fair with it, but it is, I don't know if it's the most accurate and helpful question that we have, because we're asking someone in a destitute situation to one choice, one action only. And there's a whole bunch of things factor into it. One, a lot of times the reaction you get is like, it's a domino effect of a million things, but you can only choose one. And then a lot of times there's even some insight components to it where they don't even recognize that true piece that might have triggered and caused the domino effect. I don't know if the committee could, I've been on a lot of those discussions and I'll take part, and I don't know that we've come up with a really good alternative replacement, but it's just, I don't know how accurate their response, their answers are on it. True, or
We need to review the survey.
maybe there's something else out there that,
We'll do some research for
Yep.
sure.
And we are open to editing a lot of these questions. Some of the questions are sent to us by HUD and have to be exactly what they are, but that's not honestly very many of them.
Right.
And a lot of the questions can be edited. So
two things. So number one, I know you gotta leave, so we're gonna take a vote. All good. If you have questions or want to communicate with, Mr. Gerhart, are we okay? You okay to share your email and we can
Absolutely.
ask questions? Okay, great.
actually at the top of the presentation, as well as I think on the front page of the report.
Is your email?
Yep.
Okay. And then if you have ideas about questions to include or wording with Pitt, you can reach out to Victoria, and throughout the year, I'm sure you're gonna be soliciting that feedback, right? And then do you want to phrase the question as far as voting on this Pitt report?
The question is, we would need a motion to approve the 2023 Pinellas County Continuum of Care report.
I would move approval of the PIT report pending corrections, implementation on the jail data.
I'll second it.
You okay with that, Lieutenant Page? are you going to have to then rework charts and all that? Are you gonna have to tweak your?
No, because there is a paragraph that states the limitations, but that wasn't brought to my attention, so all I have to do is add. We'll have to come up, you'll have to provide me with a very concise definition, but it wouldn't affect any charts.
Okay.
Change to 675 now.
Yeah, sure does.
Kind of like an amendment.
Well, that's whole new data, so that would be a whole new analysis, so if it changes, if you provide me with a definition that was used, I can state in the discussion saying. That, you know, this may not, I'll come up with the right verbiage, but it'll be a limitation. So I can frame it as a limitation rather than completely change.
And so when we do that, can you email out like a little addendum paragraph? Because I want to be able to take this and share it and use it and refer to the numbers with an understanding of your changes. How are we going to make this usable and not make you sit down and go through 40 hours of work?
I think leaving the 675 number in there is probably the only way to get through this without giving me a week to scrub this data, because it's gonna take time.
Yeah,
Balance in 90 days. If we make the caveat that, you know, this the verbiage, some sort of did not disclose an address at time of booking, I think. And we change all of the relative figures and definitions throughout. I got most of them referenced here. Hopefully the reader of the analysis will understand that this is not necessarily representing the homeless population, but just people that didn't have an address.
And we can definitely put an asterisk on the charts and stuff like that as well, to have a little footnote underneath all of them too, probably.
Like an amendment. I mean.
It wouldn't be able to be put in the charts, because then I'd have to go in and redo the charts, but it would be a sentence under each
Yeah,
each
something.
jail thing that's saying,
Yeah.
you know, keep this in mind.
Yeah.
Like, that's not a requirement on the thing that
No.
the verbiage said that that was just something that we do as Pinellas County, so it shouldn't really change, change to, yes, it's a change, but it's not gonna be anything that's I don't wanna say not crucial, but
affects the usability of our.
yes, correct. I mean,
Yeah, that's a fifth of the homeless population,
Right,
as
it's not-
represented in the report.
Right.
Yeah.
Because I think the way the verbiage in the report says now, you could logically say it's point in time for one day, so the real homeless total is unsheltered plus jail, and that's very misleading. If the real homeless population in the jail is 200 instead of 700, that's a very different number.
Can we go to the next?
I mean, I think to your point,
Counted in the upper portion.
to your point, we'd like to have that
Right
accurate
now, it's
data
like
for
75.
discussion for a year.
Right,
Yeah.
right.
Oh,
I mean, I want a usable report.
so that's not counted towards the total count. I just want to
Right,
clarify.
no,
that.
that's exactly right.
675 and the school is treated like the school down below.
Yeah.
But in reality,
Yeah,
if there's really, let's just say 200 of the 675 are literally
that's
homeless,
exactly.
they would be up to the top.
Because they wouldn't be counted anyone else. They're already deduplicated for
Yeah.
the fact that they were in jail, so
Right.
not counted anywhere else.
So they're not counted anyway. That's the point.
Yeah,
Yeah, so they're not repeated.
right.
That's why it's not part of the.
Yeah, so what he's saying is nobody in the unsheltered,
Yeah.
nobody in the jail count is in the unsheltered.
Right,
Yeah.
That's what he's
right.
saying.
Right, but that's why they should be up at the top
Right.
as a subset of the actual literal.
We can't do that though, because we aren't surveying them.
Right, we know we can't do that, but in terms of if we're gonna.
We're not
if we're-
surveying the sheltered people either.
Yeah, but that's data being pulled from HMIS and whatnot.
But if we're talking to our city council or whatever, and we're saying the best picture we have of a point in time. Of who's homeless in Pinellas County is sheltered plus unsheltered plus the actual homeless people who are in the jail. That's the best hit,
Right.
Yeah.
even though it's not the definition of the fit.
Why wouldn't I use
Yeah.
my school?
Because the school is too different.
It's a cumulative.
It's a different definition of
Not a
homelessness and it's.
Right.
So although it's on the same point in time, those three, so exclude the school, it's on the same point in time. But they're not counted in the jail. So that's an addition to give to your point, to paint a better picture of the community. And I think what this discussion highlighted was that that better picture of the community may be inaccurate. So that's, I think that's where the conversation is, but in terms of HUD requirements, it's the yellow and it's the top ones.
And Lieutenant Hayes, you're saying if I'm gonna talk at my council, I'm gonna add another 200 or so to 2144 at the top. About, you're thinking,
No, I think you use that 2144.
We're saying they're not counted because they're not technically interviewed.
Yeah.
We just
right,
know
right, I know,
that they're not.
but they are,
Whatever number Zach comes up with. is
Yeah.
what you-
Yeah.
Yeah.
No pressure.
In addition to the 21.
okay, so we have a motion. And a second about accepting the pit results,
Then the revised language and limitations.
with the revised language and limitations provided by Lieutenant Hayes by the end of next week. Yeah. Is
And again, we need to finish this, but I just think that just with revised language as it relates to the jail population, I don't think it needs to be
Okay.
specifically Zach. I think we all
Okay.
understand this. And then once we have those numbers, then we can all use it and say
Okay.
as accurate.
I think that's safe, thanks, with revised language. Right, we have a motion in a second, all those in favor? Aye. Any opposed? Okay, great, thank you, Lieutenant Hayes, for catching that and speaking up, yeah.
Thank you, Freeman.
Yeah, I was great, Freeman.
Thank you.
Thank
And-
you.
This will not be on the website for 5 o'clock because there are changes that must be made. So please disregard that line at the very bottom of your agenda that says it will be online soon. It will be online soon, just not that soon.
As soon as Zach's done.
Yeah.
And then we'll send out a note, you know.
Absolutely. Absolutely. Everybody will get an email with the revised report, a link to where you can find the report on our website. And then I am also working on a page that will have the web, the maps that you see embedded. So that you can go onto the HLA website and use those maps and stuff. As
Thank you for all your efforts.
Thank you,
Efforts.
everyone.
Thank you.
So much. Thank you for coming on a Friday in the heat wave.